In an oral abstract presented today, we talked about the immune health of lymphoma survivors in a population study of a large population of diffuse large B-cell lymphoma patients in California. We know that as treatments for lymphoma have improved, we have a large and increasing number of lymphoma survivors in the US. And though we have learned a lot about psychological effects, cardiovascular effects, pulmonary effects, etc., in these survivors, little is known about their immune health, and that's what we were interested in studying.
So what did you look at?
So because lymphoma and its treatments can all affect the immune system, we wanted to look at survivorship specifically, and so we turned to the California Cancer Registry, which is California's statewide population cancer surveillance program run by the California Department of Health. And we identified a large group of diffuse large B-cell lymphoma survivors, over 21,000 patients who were diagnosed as adults and who had survived at least 1 year after diagnosis. And then we linked their records to statewide discharge databases and mined all that data for infectious diseases and autoimmune conditions that those patients were diagnosed with in 1 to 10 years after cancer diagnosis in the survivorship period.
And what did you find?
So interestingly, we performed 4 different comparisons. We compared lymphoma patients to survivors of breast cancer, prostate cancer, head and neck cancers, and melanoma. And in each case, we looked at incident rate ratios. We estimated these using a Poisson regression analysis. So in each comparison, surprisingly, we found similar diagnoses coming up as top scoring hits. And some of these are already known associations with lymphoma. For example, autoimmune cytopenias like autoimmune hemolytic anemia and thrombocytopenia, as well as deficiencies in humoral immunity, which likely represents persistent hypogammaglobulinemia, and Sicca syndrome, which is an autoimmune condition affecting salivary glands and tear glands. But we also found, interestingly, a high incidence of viral and fungal pneumonias in all 4 comparisons, up to 9-fold increased in the lymphoma survivors compared to the comparator arms. In the case, we also found increased rates of meningitis in several of the comparisons, suggesting that lymphoma survivors are at increased risk for many of these serious infections during the survivorship period. The only diagnoses we found to be of higher incidence in the comparator arms, in the breast, prostate, melanoma, or head and neck cancer survivors, were ones that are already associated with those diseases. For example, vitiligo, which is an autoimmune disease directed against melanocytes in the skin, was much more common amongst the melanoma survivors. And cervicitis and endocervicitis was much more common amongst breast cancer survivors, likely related to the fact that they take hormonal therapies.
What can we do with this information?
So this work has a lot of implications. It's sort of a beginning point. We'd like to know what features of patients' disease and treatments really contribute the most to these altered risks, potentially in the future to modify how we manage patients, but certainly to determine how we track patients during survivorship, what we tell them about their risks, and how we follow them and diagnose them for these conditions.
And you were looking at mantle cell lymphoma patients as well?
In this population-based study, we were looking at diffuse large B-cell lymphoma patients. But this is also, to validate these results, we are planning a large Stanford-based study of lymphoma survivors to look at prevalence and incidence of immune-related conditions. And in that study, in which we hope to gain a much more comprehensive look at the immune system of lymphoma patients and then how that influences diagnoses during survivorship, we are planning to collect peripheral blood samples from all these lymphoma survivors and immunophenotype them using single-cell mass cytometry. And so, as a pilot study to look at the feasibility of this question, of this approach, we took a cohort of 11 mantle cell lymphoma patients who had been uniformly treated with induction chemotherapy and stem cell transplant, as well as a vaccine maneuver as part of a clinical trial. And we looked at their peripheral blood during survivorship. And this was sort of medium-term survivorship. On average, they were 2.5 years out from diagnosis, and they had from the end of treatment, and they had no evidence of disease at the time. So we took their blood and performed a large immune profiling experiment using single-cell mass cytometry and about 37 markers that delineate cell subtypes and also cell functions, and compared these to 11 age-matched healthy controls to look for repeated immunophenotypic alterations. And in that analysis, even in the small cohort of patients, we found consistent alterations, especially in T-cell phenotypes. with skewing towards more CD4 cells compared to CD8 cells, skewing within the CD4 cells towards more memory phenotypes. And also we see markers of expression that suggest more antigen experience, possibly exhausted T cells, which would certainly influence the potential for autoimmune diseases and infections in the future, and suggest that these patients may have some level of impaired immunity compared to the age-matched controls.